Hi everyone, I'm Yun Huang, and the topic of my project is about the influence of participation in extracurricular activities between Taiwanese children with and without physical disabilities. First of all, I want to introduce the conceptual framework about the participation. And this is the ICF model, and which was introduced by the WHO. It assumes that a person's health status can be impacted by different components, and participation is one of the components, which is defined as a child's involvement in their life situation. So all the activity a child participates in his life can be included as participation. So the importance of children's participation is that provide children context to develop their milestone, and when they involve in this life activity, it enhances children to develop their skill, social relationship, and meaningful life. So for children with disability, actually this is important for their development outcome. So in this project, we focus on participation in extracurricular activities, which include play, sports, social connection, entertainment, and so on. And also the literature shows that some personal and environmental factors has significant impact on the patterns of participation in extracurricular activities for children with disability. So the factors include, like for example, children's age, gender preference, and their parents' education level, number of children in the family, family income, type of community, and so on. When we review literature, we also found a research gap. Most of the research were conducted in children from Western countries, and little was known about what kind of personal and environmental factor can affect participation in extracurricular activity for children from Eastern Asia, for example, China and Taiwan. So the research purpose of this project is to examine the relationship of the demographic factors such as children's age, gender, parental education level, and the diversity of frequency for participation in extracurricular activity for Chinese-speaking children with and without physical disabilities. And the research question we are asking is, are Chinese-speaking children with and without physical disabilities involvement in extracurricular activity associated with age difference, or associated with their gender difference, or associated with their parental education levels? So we assume that children's age can significantly predict the participation, diversity, and intensity for our targeted children. And also children's gender can significantly predict it. And in addition, we assume that Chinese-speaking children are raised by parents with higher education level have significantly higher diversity and intensity of participation than those raised by parents with lower education level. So for the sample in this study, we include two groups. One is parents with their children with physical disability, and the other is a comparison group, which include parents and their unaffected children. And their inclusion criteria include their language and their health condition, and also their age. So for the measurements participation, we use one standardized questionnaire called the Children's Assessment of Participation and Enjoyment. And because we used Chinese-speaking children as our target population, so we choose the Chinese version. And for the personal and environmental factor, we use one demographic information to collect their child's age, gender, and also their parental education levels. And for the CAPE, it includes 55 different activities, and it can be classified into two formal and informal activities, or 5 different subdomains, which are the recreational, physical, social, skill-based, and self-improvement. And for the measurement CAPE, the dimension of the response category, we are interested in participation, diversity, and intensity. So diversity means how many activity a child really involved within the 55 different items. And for the intensity, we ask how often did they do this. 1 is once in the past 4 months, and 7 is once a day or more. So higher score means higher frequency. And for the data analysis, we use multiple linear regression analysis, and the independent variable are the children gender, age, and parental education level. The dependent variable are the total and the subdomains participation scores. And also we run the children with and without physical disability separate. Now these are the participant demographic information. It's about the gender, diagnosis, age. And also in the result, we can see for the participation diversity in children with physical disability, a child's age and their father's education level are significant predictors. And for typical developing children, participation diversity can be predicted again by children's age and their mother's education level, and also their father's education level in different subdomain activities. For participation intensity, in children with physical disability, again, a child's age and their father's education level can be the significant predictors. And for children with typical development, their participation intensity can be significantly predicted by the child's age and the mother's education level. So, for a children's age, the Taiwanese children with physical disability and their typical developing peers, all the children had significantly lower overall participation diversity and intensity than younger children. And for Taiwanese children with typical development, girls had significantly higher participation diversity in social and skill-based activity than boys. And Taiwanese children with typical development who rise by mother with higher education level had significantly higher participation intensity in formal and skill-based activity than those by mother with lower education level. And also Taiwanese children with physical disability who rise by a father with higher education level had significantly higher overall participation diversity and intensity than those by father with lower education level. So this result give us the clinical message is that since we know participation status is important for children with disabilities, is for their development outcome. So understanding the relationship of the participation pattern and their factors is important because this knowledge assists healthcare providers to identify what kind of variable can influence children's participation status and may cause a risk to their participation. For example, when we see older children has lower participation intensity or diversity, we can predict, that's because affected by their age. So we will not interpret that this is because their health condition or something else. So this helps us the understanding about their participation and in their influence. But there is still some limitation about this project. For example, the sample can include more other physical disease, for example, spinal cord injury or autism or other disabilities. And also some other potential impact factors such as severity of health condition, environmental barriers, or their family financial status can be examined in the future study. So this is my presentation. Thank you.